You're welcome to Medical Sciences Made Easy. And in this session, we want to look at the renal function tests. We want to discuss renal function tests, what we call RFTs. We want to see how do we assess the functioning of the kidney in our body. And before we look at the tests which we do under renal, we have to first look at the function of the kidney. Functions of the kidney. Before we assess its function, we have to be knowing what does it do. And previously we looked at how the kidney participates in urine formation. So if you haven't watched that, please go there and watch. And always remember to subscribe. Subscribing will always enable you to be notified whenever we release other videos so that you don't miss out. And always like the video and subscribe if it is of help. So there are many functions of the kidney in our body, whereby this kidney plays a big role in acid-base balance. It maintains acid-base balance, and this is what we call maintenance of pH, especially looking at the reabsorption of potassium, of hydrogen ions and bicarbonate ions. It is able to maintain this acid-base balance. And whenever the kidney fails to do this, we see normally conditions like metabolic acidosis and metabolic alkalosis, whereby it is failing to maintain the balance between the hydrogen ion and the bicarbonate. And another function of the kidney is that it maintains blood pressure. It maintains blood pressure. So this is the homeostatic function of the kidney, whereby it maintains blood pressure. How? By RAS system. The interplay of renin, renin, aldosterone, angiotensin system plays a big role, whereby the renin is going to convert angiotensinogen to angiotensin. Then we see the interplay of angiotensin, and this is what also enables the kidney to maintain blood pressure. So whenever you have kidney failure, you also see the problem of maintaining your blood pressure. And another function here is that it maintains water balance in the body. Maintains water balance. You can call it water balance or blood volume. How? Because we know that the kidney is always stimulated by antidiuretic hormone, or what we call vasopressin, produced by the posterior pituitary gland. So this vasopressin or antidiuretic hormone is the one that enables the kidney to regulate water. And whenever more water is reabsorbed, even the blood volume increases. So this one, we see it in the distal convoluted tubule. Majorly, we see it in the loop of Henry and in the collecting duct, whereby this kidney is playing an important role in maintaining water in the body. And that's why you see, whenever you have taken much water or during a cold day, you urinate excessively, what we call polyuria. And on the dry day, during strenuous exercise and not taking water, it results into what we call anuria or reduced urinary output. Another function of the kidney is it plays an endocrinology role, whereby it produces hormones, whereby hormones like erythropoietin hormone, thrombopoietin hormone. And these hormones play a big role in homeostasis, in hematopoiesis, whereby this one triggers erythropoiesis, that is the formation of red cells, and this one triggers thrombopoiesis, which is the formation of platelets. So we see this one being done by the kidney. And this kidney also, it maintains calcium levels. It maintains or regulates calcium, blood calcium levels by production of vitamin D3. And this vitamin D3 is known as 125 dihydroxycholecalciferol. Dihydroxycholecalciferol. And this is the one that enables reabsorption, it enhances absorption of calcium within the intestines. That in case there is no calcium levels in blood or in the body, this kidney produces 125 dihydroxycholecalciferol, or what we call calcitriol, and it is responsible for increasing or enhancing absorption of calcium within the intestines. So these are some of the functions of the kidney, and not forgetting the major one, which is always excretion of waste products of metabolism. Waste products of metabolism are like urea, creatinine, uric acid, ammonia, all these, and drugs. All these are excreted by the kidney. So these are some of the functions we can talk about, functions of the kidney. So whenever you're asked in an exam also to outline any 5 functions of the kidney, please don't fail to do this. And after we have known the functions of the kidney, now we need to see how do we assess if the kidney is not functioning. How do we assess the functionality? Or how do we know that the kidney is no longer functioning well? And the tests we do under renal function tests. Renal function tests, we normally assess urea concentration, we assess creatinine concentration, we assess, and this creatinine enables us also to determine GFR, what we call glomerular filtration rate, what we call renal clearance. And still we can also do uric acid levels. Then plus electrolytes, which we shall see later on. Plus electrolytes. So these are the major tests done under renal, whereby we have urea concentration, we have creatinine concentration, glomerular filtration rate, uric acid, electrolytes, and some advanced labs we also do microalbumins. Microalbumins, especially to people with diabetes and hypertension. We are entitled also to do microalbumin, and we also determine albumin creatinine ratio. This one we can use it to determine albumin creatinine ratio, which can enable us to monitor patients who are diabetic. So without wasting time, we are going to begin with number 1, which is determination of urea. I want to see how do we determine urea in the laboratory. Determination of urea. There is a video which I released about urea formation. Please, if you haven't watched it also, you can always visit it. How urea is formed in the body. Because it is important to know how it is formed before we assess it or we determine its concentration. So this urea, it has the molecular formula of, this is its molecular formula, whereby it has 2 amine groups. So this is the formula of urea. And in the laboratory, the sample we use for renal function tests, or the specimens we use, the samples we use here, we use either serum collected from red top or plain top, or we use hyperinized plasma. Hyperinized plasma. So these are the samples of choice. Either you use serum from red top, plain red top, or you use hyperinized plasma. These are the two samples we can use, and still we can also use urine. But whenever we use random urine for the urea concentration, we dilute it 1 in 20 before we determine it. So these are the samples we can use to determine urea concentration in the laboratory. And note that the sample to determine urea should never be corrected in fluoride, in sodium fluoride bottle, the fluoridated bottle, and should never be collected in ammonium oxalate bottles. Ammonium oxalates. Why? Is that fluoride is a poison for ureas. So whenever you use the fluoridated bottle to determine urea concentration in blood, we find that fluoride will go and inhibit action of ureas in the reagent. So this fluoride, it inhibits action of urease enzyme, so that's why we cannot use it. So whenever you use the fluoridated blood from a fluoride bottle, you get false results because of inhibition of urease enzyme. Then when you use ammonium oxalates, remember urea contains ammonia. So whenever you use ammonium oxalates, it gives you false high. It gives you false high results due to addition of the ammonia. So these are one of the precautions we should take when we are assessing the tests of the renal. And another thing we do here is that after getting the samples very well, we need to know the methods we can use to determine. And methods under urea, we use majorly Berthelot's method, or we can use enzymatic method. Enzymatic method. These are the major two tests that are being done, but there is also another one known as diacetyl monoxide. But in this video, we are going to concentrate on these two because these are the major ones which are being done in the hospitals. So we are going to look at their principle. We see we shall see the reference ranges of urea. We are going to see the interpretation of results. For the procedures, we are not going to look at them because every manufacturer comes with their own instructions. So each company has its own instructions. So we shall always be saying that, please, before you start doing the test, you read the insert or the manufacturer's manual before you begin determining the urea concentration. So let us begin with the Berthelot's method of determining urea. But before we begin this method, we should also know the significance. Should know the significance of renal function tests. Why do we do renal function tests? That is the significance. We do these renal function tests here for diagnosis or to diagnose of renal diseases. We can do these tests to monitor people on treatment, to monitor patients on treatment of certain conditions like antiviral. Some people who are on treatment of antiretroviral therapy, ARVs, like tenofovir. We are also using this to mentor patients on this, and also to mentor people with diabetes mellitus, also to mentor people on treatment of hypertension. So the doctors recommend these tests when people are on the treatment, when they are diabetic every 6 months or quarterly, when they are hypertensive, and when they are on treatment of antiviral drugs. And also we can use them to assess the functioning. To assess the functioning of the kidney, or the kidneys, especially by doing GFR and creatinine, using creatinine as a marker. So these are the major ones, and still we can also do renal function tests to determine the severity. When patients are already having kidney failure, but we want to see we want to classify it into stages, because we know it can either be mild, it can be moderate, it can be severe, and also it can be end-stage renal failure. So we can also determine GFR. We can do GFR to determine the severity of renal failure. The severity of renal failure. So these are some of the significances why we assess the functioning of the kidney using these tests. So as we said, we are going to begin with the Berthelot's method of urea determination. We want to begin with Berthelot's method. Berthelot's method. And this Berthelot's method, it utilizes an enzyme urease, in that when if I have urea in a sample, this is in serum for polymerized plasma, this urea is broken down by urease enzyme in the reagent in the presence of water, because this is a hydrolysis reaction whereby urease catalyzes the hydrolysis of urea to ammonia, ammonium ions plus carbon dioxide. But we are interested in the ammonia formed, where these ammonium ions formed, they are going to react with alkaline hypochlorite, react with hypochlorite, that is GIC, and this hypochlorite should be in presence of phenol, and in alkaline media the media should be alkaline in the presence of sodium nitroprusside as a catalyst. Sodium nitroprusside is acting as a catalyst in the reaction, whereby catalysts speed up the rate of biochemical reaction. So this sodium nitroprusside, when I have ammonium ions, I add hypochlorite in the presence of phenol and sodium nitroprusside as a catalyst in alkaline media. I form a blue endophenol, a blue colored complex known as endophenol. And this endophenol, which is formed and is a blue colored complex, it is read colorimetrically. You can read this. The endophenol formed colorimetrically at 540 nanometer wavelength, and the intensity of this blue color formed is directly proportional. Directly proportional to the amount of urea in the sample. So we are saying that in this Berthelot's method, we have reagents like urease reagent, we have sodium nitroprusside also in the reagent, and hypochlorite plus phenol. Then we provide alkaline media in the form of hydroxyl ion, so that is sodium hydroxide. So whenever we have urease catalyzing the hydrolysis, this reaction is the hydrolysis reaction. because it involves the addition of water. So it catalyzes the hydrolysis of urea, ammonium, and carbon dioxide. Then the ammoniums formed react with hypochlorite in the presence of phenol in alkaline media with sodium nitroprusside as a catalyst, form a blue endophenol, which is measured colorimetrically at this wavelength. And the intensity, please never forget that the intensity of this color is always directly proportional to the amount of urea in the sample. And this is, so, and whenever I ask you that during Berthelot's method, which of the following is used as a catalyst, or which of the following is the function of sodium nitroprusside is acting as a catalyst. It is speeding up the rate of biochemical reaction. And never forget that it is read at this way. After knowing this principle, I told you the method is per manufacturer's mind. Because every manufacturer comes with his instructions. So it is advisable for the lab people or personnel to always read the manual before they do the test every time. And always do the control every time and the stand. Make sure you have controlled your machine and it is doing well. So the reference ranges of urea is 15 to 45 milligrams per deciliter, but it is also always advisable as a lab to always come up with their reference range according to the locality where you are based. So, but this is the most reference range used across, whereby it is always 15 to 45 milligrams per deciliter. And whenever I do this, some doctors can also request for what we call blood urea nitrogen. Blood urea nitrogen, whereby this one is known as BAN, blood urea nitrogen, where this blood urea nitrogen, for it is, you don't need to buy the reagent for BAN. So long as I have determined the concentration of urea, I can use it to determine blood urea nitrogen, whereby we use the formula that BAN is equal to, first of all, we know that the molecular formula of urea is this. So we can calculate the relative formula, the relative molecular mass, whereby relative molecular mass is that we have two nitrogen, and nitrogen, atomic mass of nitrogen is 14. So we get 14 times 2 plus hydrogen, I'm seeing 4 hydrogen, and the atomic mass of hydrogen is 1. So I get 4 hydrogen times 1. Then I add the carbon, and we know that the atomic number of carbon is 12. Atomic mass of carbon is 12, and it is only 1, so I multiply it by 1. Then plus oxygen, which is 16. 16 times 1. And the total I will be able to get 60. So the relative molecular mass of urea is 60. And after getting that, I can use the formula whereby we know that BAN is equal to, because we are now interested in the nitrogen, and the total number of nitrogen is 28. So to calculate blood urea nitrogen, you get 28 out of 60, which is the total, the 28 which is the nitrogen in urea. Then out of the whole total, which is 60, times urea concentration. And this is the formula you can use to determine blood urea nitrogen. And even if I have BAN, I can also use it to determine urea by making urea the subject of the formula, whereby also urea concentration is equal to 60 out of 28 of BAN. O times ban. Still this one, I have made urea the subject of the formula. So these are the methods I can use so that when I have ban, I can get urea, when I have urea concentration, I can get blood urea nitrogen. And if I have also urea concentration, I can also determine ban. When I have ban, I can determine urea concentration. So these are the formula. For example, if a patient came and I determined his urea concentration, and the urea, given that the urea concentration of this patient was 60 milligrams per deciliter, and I ask you to calculate ban of blood urea nitrogen. To get blood urea nitrogen is equal to 28 out of 60 times urea concentration, which is 60, and this 60 will go with this, and I get 28 milligrams per deciliter. And the reference range of ban is 8 to 20 milligrams per deciliter. So we can even ask you to comment on the results, whereby now this patient of ours, we see his ban is high and even his urea concentration is high. And when they are high, we call that condition as uremia or azotemia. And in the next video, we shall look at how do we interpret these results and how do we help our patients to treat them. As I finish this, we want to look at another method. We have seen Berthelot, and another method we can use. We have seen Berthelot. We have seen how we can use urea to determine blood urea nitrogen, and lastly is enzymatic method. The second method we can use is the enzymatic method, whereby this enzymatic method, it starts with the same, whereby when I have urea, it is hydrolyzed in the presence of urease enzyme to form ammonium ions plus carbon dioxide. It catalyzes the hydrolysis. Then the ammonium ions which are deliberated, they react with 2-oxoglutarate or alpha-ketoglutarate to form glutamate. And this reaction is a reversible reaction which involves a coenzyme, and this coenzyme, it involves NAD, whereby NAD is being reduced to NADH in the presence of an enzyme known as glutamate dehydrogenase. So we see glutamate dehydrogenase is catalyzing the oxidation of 2-oxoglutarate by adding ammonia, by removing the hydrogen ion to form glutamate. And when we form this is the kinetic method, meaning that we are going to monitor the rate of formation of NADH. So here we monitor the rate of formation of NADH, that after action of glutamate dehydrogenase enzyme catalyzing the conversion of 2-oxoglutarate to glutamate, we monitor continuously the rate of formation of NADH. So the rate of formation of NADH is monitored continuously. At intervals, at a fixed time interval, spectrophotometrically. We use spectrophotometer at 340 nanometer wavelength. And the intensity or the rate of formation will be directly proportional. The rate of formation of NADH is directly proportional to the amount of urea in the sample. So this is the enzymatic method where it involves two enzymes, that is urease enzyme and glutamate dehydrogenase. And it is a kinetic method where we monitor continuously at a fixed time interval. Like after 30 seconds, we monitor the rate of formation of NADH. So we have seen that this is the principle under this, and the procedure is always per manufacturer's money. And we have seen how we can also use this to get urea concentration, and this urea concentration we can use it to calculate burn, and we have seen also the reference range as 15 to 45 milligrams per deciliter. And we have also seen the reference range of blood urea nitrogen, which is 8 to 20 milligrams per deciliter. Thank you so much for watching until the end. This is Medical Sciences Made Easy. Please, if you haven't subscribed, always make sure you subscribe to keep, so that whenever we release the video, you are notified. Thank you so much.